HIV is a healthcare issue, a chronic healthcare issue. It needs constant care and treatment in order for people to maintain their health and well-being. What is happening in the healthcare system here, based on our client testimonials, is that they feel they are not welcome. They feel they're discriminated against. And it is very surprising, because people would assume, because you're a healthcare provider, you should know better because you've been through medical school and you're dealing with a medical issue. But there are popular perceptions and social perceptions that override sometimes your medical knowledge and expertise. We find clients feeling that they need to go to Toronto to seek services and not be here in York Region, because they will not get the kind of care they want, or they will end up being in a situation where they have to be dehumanized or stigmatized and discriminated against.
HIV is not something that is intensively covered in medical schools unless you're going into like infectious disease specialty.
Even doctors, a lot of doctors are uneducated. Every time I go to a doctor, and she's always scared to prescribe anything to me because it might, enhance my HIV.
For the number of people living or affected with HIV/AIDS in York Region, there is a limited number of healthcare providers. There's one, maybe two doctors that are specialized in helping people with HIV/AIDS in York Region. And York Region has millions of people, and it's just so many people to serve, and people are going to get pushed down.
I've even heard a story of dentists, also same thing, where dentists have been uncomfortable prescribing, let's say, an antibiotic or some sort of freezing medication or anything like that, because they're unsure of what HIV medication you're taking, or they're unfamiliar with it. So they've straight up told clients, I can't do this procedure on you because what I normally use, I don't know if it interferes with your medication. So they don't do the procedure, right? And it all goes back to, I don't think people are maliciously discriminating, but they're kind of washing their hands and passing it on. So that's one of the biggest concerns that I hear. Thank you so much.
You die in cancer too, you die in HIV too, you diabetic, they have heart attacks, their kidneys fail. Like, it's, any disease is a disease.
And he was a young doctor. I just felt like he was trying to get me to go to somebody else. He didn't know how to take care of it. I don't know, I just didn't like... If I wanted to go there with a cold or a headache, yeah, he could deal with it.
In the hospitals, and I've said this, they really don't understand it.
Or what makes you behave differently towards a person living with HIV? What are the things are you struggling with? Understand that first, and pass on information on how HIV is transmitted. What are the medical needs of a person living with HIV? What are the common illnesses they might be dealing with? When they come into the healthcare system, how are you engaging with them, and how can you create a barrier-free environment by ensuring that you're checking your own competency around trauma, around addictions, around mental health issues, around HIV stigma and discrimination. And we work to build those competencies and make sure that people have the right kind of knowledge and the right kind of tools in order to service the person who's coming into the healthcare system.